And sometimes it's like we're just not quite cut out for that like productive grinding lifestyle. And it's so hard to step back and think of like, how else can I do it? But I think once we really give ourselves permission to ask that question and get serious about it, it really opens up doors and makes life feel a little easier to live.
Welcome to Invisible Not Broken. Today, we're talking about physical therapy, grind mentality, and productivity with chronic illness. Our host, Monica, is joined by physical therapist Rita White.
So you are my twin in all of the diagnoses.
Oh, really?
Yes.
Oh,
Hypermobility, Ehlers-Danlos, mouth activation disorder, and POTS.
yep. They like to go together.
They really are the unholy group of friends. Like, it's the plastics and Mean Girls.
Exactly.
Or, I'm sorry, you might be too young for that reference. I'm so sorry.
I'm not at all. I'm with you.
So we're talking to you from your office, and I am beyond impressed. I can barely get out of that bed over there. I have my whole office set up by my bed, and you actually do things. So tell me about your life.
Yeah. So work-wise, I'm a pelvic health physical therapist. So I have my own practice now. I went full-time to that about a year ago, but I specialize in treating people that have hypermobility, EDS, POTS, and then I also do kind of the pelvic health side of things, which a lot of times goes together with all of that. So yeah, a lot of what I specialize in is kind of the complex chronic diseases, illnesses, conditions. A lot of people come in, that they don't have names for what's going on or they're suspecting something. So I can kind of help, them tease out maybe what's going on and get them resources and all of that. So yeah, it's been really cool to be able to be on my own and figure out how to do that. I never thought that that's where my career would go. So it's been a learning experience, but it's good.
It's such an exciting career thing because even those of us who are lucky enough to get diagnoses, which it took my doctors almost 30 years to actually figure out what was wrong, there's very little discussion on pelvic health. And I had 2 children before I was diagnosed.
Okay.
Yeah. And so to have had like someone who actually knew what was going on with like hip bones and dysplasia and, after giving birth and all of like the mess up of like the bones after that, it would have been so helpful. And none of my doctors, even after I was diagnosed, had the first idea of what that would do to different parts of the body. It's just like, expect some dislocations. You're probably going to faint a lot. And like, that was about all the help I got. Like,
Oh, wow.
wrong. So for anyone who's listening is feeling hypermobile or, what can anyone do about pelvic health I now have a great physical therapist, which is where you are. And while I'm a big fan of my opioids, the physical therapy has got to be right up there with like the things I do for pain. And he has me do bridges, which is like my absolute number one favorite thing to do when I don't dislocate my legs. What are some things you think of that you could help out with the pain and with what people are dealing with?
Yeah, I think it's such a good point that we just need multiple things to help with pain. Like the pain that people with hypermobility experience is so unique, I think, because it's both like acute and chronic. And so we just like have to go at it from so many different angles. And so like meds and supplements and all of those things can be so important. But then I think it's also like thinking outside the box of what else can we do? And it's sort of like developing these toolboxes for like all the different flavors of pain that we might have because there's a lot, but just like feeling like we have a little more control over it, I think can be so helpful. So like the first thing that I love to do is just be able to educate people so they feel like they have a better understanding of what their pain is. Like first and foremost, pain is, this protective mechanism telling us like something's not right. So if we can kind of figure out what it's telling us, then we can figure out what we need to do about it. And then from there, it's like, do we need hands-on manual therapy to help with a subluxation or a dislocation or, ice or heat or TENS or acupuncture or, like there's so many things that just, they need to hug a cat. Even it's like, there's lots of tools.
She's quiet this whole time until I started talking to you. She has not moved in the last 3 hours until this started, but fine. She'll just be there. We also have the 2 dogs out there and we had the chickens up top, but I swear we're in some sort of ritual calling like some sort of old chicken god. They were all in some sort of circle just doing this cluck chant that was a little terrifying, to be honest. I mean, if they were bigger, I think we'd all be in a lot of trouble. They are
Yeah.
stupid, lovely little animals. You make some of the most wonderful points and it's something that frustrates me because I feel like a lot of the times especially in the United States, we have this weird like bootstrap theory of push through pain. You're weak if pain is weakness leaving your body. Like we could go through all of the stupid gym sayings that are everywhere. And I went on a deep dive on your TikTok and your Instagram page, which was some pretty helpful information. And it's really, I love what you're saying about finding those different things. You had a talk where you were discussing the problem with pushing through and of compensating. And I cannot tell you how many times, like I was a ballerina back in the day, and how many times I made my injury so much worse because I was going to get through that movement no matter what. And then using the good leg to compensate for the bad leg. And then the good leg, of course, becomes the bad leg.
Yeah, absolutely. I think the compensating and then pushing through the pain are just such common things with hypermobility and chronic illness because it's like that's what we're told to do. And, a lot of people are kind of gaslit from early ages too. And it's like we're in this body where it's all we know. And so we think the pain is just that must be what everyone else is experiencing. And somehow other people are figuring it out and doing it. And like, and you bring it up when you're young, people just tell you like, oh, you're fine, or oh, it's just growing pains, or, like it'll just push through it. It'll be okay. And like, I know when I was younger and I played soccer, like I played very competitively and like I just hurt so bad. And I just thought, oh, I guess that's what everyone feels. And, looking back, I can see kind of specific things that are like, no, that was because of hypermobility and probably isn't how everyone actually felt. So I think we're just so used to pushing through it. But we know now that, to manage pain, you really need to feel safe because pain is our survival mechanism. And so like our brain doesn't care if we make it to just the next moment or like 100 years from now. It's like it just wants us to get to the next moment, the next moment, the next moment. And it doesn't really care if we feel happy and great doing that or if we just like are miserable and in pain. And so being able to like identify, okay, there's a signal here that's telling us that there's a threat. So how can we tune into that and help ourselves feel more safe in the moment? And then sometimes we have to then come at it from, what can we do that actually now feels good? Because that survival instinct of pain is so strong that it's always going to be front and center. And so that'll take over. That's what it's made to do. And so if we don't kind of do the both, right? We have to like feel safe. And that's not to say that you just ignore it, but it's like first kind of acknowledging it and then coming to a place of like, okay, what could I do that would help my body actually feel good right now?
So, real talk, since you actually are a professional and you deal with pain all the time, can we just explain to all parents in the world that growing pains are not supposed to leave someone on the ground rolling around crying, that that's not normal?
Exactly. That is not normal. Yeah. I mean, I think that I don't know really much about growing pains, like, and why I think it's just a convenient excuse as a parent to like not really look into, what's going on. And understandably so that if you have a kiddo who's complaining and you take him to the doctor and the doctor says, everything should be fine, like you're going to try to just, keep affirming them that it's like, oh, it's probably okay. So I think, like you just said, the point is that if a kid is diagnosed with growing pains and they don't ever outgrow them or they seem worse, what you might think a growing pain should be. It's like you keep advocating, keep trying, keep pushing for better care because that's likely not the end of the story. And I think first and foremost, if you just believe your kid that something's going on, and sometimes it's hard to, believe a kid over a professional who's supposed to be very knowledgeable and have the answers, and is in like a place of power. But I think for people that are hypermobile and have gone through all this pain, it's like, if you had someone from a young age that really was on your side and believed you, that's worth a lot.
I think we're going back to what you said, which is you have to feel safe to start addressing pain. And I'm sorry, I threw my own trauma into the whole discussion and I'm sorry about that. I think where I was trying to go with that is with the whole being taught, like you're just supposed to like push through, kids are dramatic. I just kind of want to start getting into like the public consciousness that children aren't necessarily dramatic. And sometimes pain is a really good, as you know, we have our own pain. I have two children, and that was something I was really conscious of when they were growing up, was like not minimizing what they were feeling. Cause I felt like when I was growing up, that was really like a trust issue after a while. And what's normal, what isn't normal. I just thought I was bad at humaning. I still might be very bad at humaning. That's fair. I am bad at being a person and an adult. But when I was growing up and I was seeing everyone else running around at the same age I was, probably the same growth rate I was, without like feeling like there's shards of glass in their bones. That maybe I was just really, maybe they were right. Maybe I was dramatic, but still couldn't run. And it'd be nice if more doctors and adults had more education on what to expect from growing bodies, so that, especially for, and you know, anyone who presents as female, I think already deals with a lot of gaslighting anyway, and especially when you're growing up, and whether what pain is normal and not normal. And if you're younger and you can get a diagnosis for Ehlers-Danlos, you have more opportunities to work with physical therapists and offsetting.
Exactly. Yeah. And I think it comes back to like, no matter what, pain is real because you're experiencing it. It's like, it doesn't matter necessarily like the why, the where, it's like if your kid is telling you they're in pain, like they're in pain because they're feeling pain. And that means that it's real. And now we know that, there's lots of factors that influence pain. And so then we can start to kind of tease it apart to get at, what's going on. And likely pain comes from a whole bunch of different things. And like we talked about before with EDS and POTS and mast cell, it's like pain can be super complex. It's probably one of the most complex pain conditions just because of how like acute on chronic it can be, and that it's the whole body and it's jumping around all the time. And I think that is what can make people think, oh, that can't possibly be, and we're not great in the medical system of looking at the body as a whole or from a systems point of view. And so, if a kiddo says, oh, my knee hurts, and they go in and they do, maybe even imaging, and it's like everything looks fine. But then the next day it's, well, now my shoulder hurts. And, once you start having all these complaints like that, it can, I think, be easy to just dismiss that because it's like, how can that possibly be? But if we have this education and look at it from this systems viewpoint of, there's something going on with your connective tissue. There's something going on with your nervous system, looking at it like that, or your immune system with mast cell, then all of a sudden it's like, oh, that's absolutely possible that you might be feeling these symptoms jumping around like that. And it makes sense. And now we have treatment options for you. And one thing as a PT, of course, I always think it's like therapy is, it's great conservative care. It's fairly cheap and accessible for people. And yet doctors don't refer people to those specialists. So, we're like pain and movement specialists and we want to help people. And so if a parent has a kiddo with pain, they go to the doctor and the doctor kind of dismisses it, just understanding too that they're not necessarily the experts in that and that there are other options. You can see other professionals and get different opinions, and there's more help out there.
I'm annoying about physical therapy for like everything and everyone because it is so underused. And I watched how, like for myself, but also my dad was COPD and in bed all the time. And when he did better was when he had a physical therapist who just taught him how to work out in bed. So like you can even see my bed over here is I have my office in my bedroom. I have like Pilates equipment attached to my headboard because there are many days I can't leave the bed. So I still get to do like these different muscle techniques that I've learned. It is such an underutilized thing. And I wish more doctors get their heads around it. I want to talk to you personally about you have a practice, you're a physical therapist, physically demanding. You have 3 complex conditions. I would love to know more about how you're able to handle your bad days when you have patients coming in.
It's a good question. I think the answer is that I'm probably very much like everyone else and have the tendency to just push through and not always make the best decisions and all of that. But I think what it comes back to is I do feel so. I had a bad concussion about 5 years ago and didn't work for about a year. And so prior to that, I was living with POTS and mast cell, and I was definitely more, I went through PT school when my POTS was kind of at its worst. And it was certainly, I was completely in the like, just push through, get through it. I hardly talked about it because I was so scared that if people knew, I wouldn't be allowed to become a physical therapist. And so I just like did what I could. And, it's pretty terrible. And I think I was pretty dissociated for most of the time, but somehow made it through. And then I kind of told myself, okay, I have a job. Like I have to work 40 hours a week and I'm not allowed to take a sick day unless like, I have a fever or the flu or whatever. So I really just didn't let myself like have bad days and take a break, which looking back, like was not healthy or sustainable at all. And so there's a big learning curve there for me. Like I was never going to make it in a full career. And so, I started to have some burnout, had to kind of look at doing things differently. And then I ended up getting this concussion and that just like completely changed how I looked at everything. And so I can remember just laying on the floor, spent a lot of time laying on the floor during those concussion days and just thinking like, okay, I don't know if I'm ever going to be able to get back to full-time work or if I really should get back to full-time work. So how can I do this? And that's when I kind of started thinking a little bit more outside the box. Like, how can I kind of design a work life that might work for me? And I feel fortunate that, I have some skills and, this passion for what I do where it's like, okay, there is a lot of space to be creative with this. So yeah, that's when I decided to open my own business. So I was doing kind of both jobs part-time and then went to doing my own practice full-time. So I guess what it allows me to do is have more time of seeing like less hands-on patients. That being in a PT clinic was very like, on the hour, every hour. You hardly had time to eat or go to the bathroom or, just do those like self cares. And so it's so nice now that I can have full control of my schedule. So I can decide like how many people I want to see a day and a week. And do I want time in between seeing people so that I can, stretch and move my body the way I need to, or I could pop outside for a minute or, give myself long time to take a lunch break. So I think just kind of the structure of the day to day where it's like, do I do better if I sleep in and schedule my patients more towards the afternoon? It just kind of depends. So I've been figuring that piece out, but I think it's really getting clear first and foremost with like, what do I need to do to take care of my body? And then how can I kind of structure my work around that? And so far it's been pretty successful. I definitely have times where there's, flare ups where I have to, I get ill and have to cancel patients. And that's so hard because like you want nothing more than to just be able to be there and push through. But the great part in my practice is I, work with people who understand it and get it. And I think it kind of gives us all permission to just be like, you know what, we have to take care of ourselves first to be able to, put out the work we want to do in the world. So again, kind of a long-winded non-answer.
Long-winded or non-answer at all. I mean, from what I if I can see if I'm correct in what I'm breaking down, is number one, we never free just ourselves. We free everyone around us. So if you're able to be open and you're safe enough to be open, people feel like they can discuss this more with you. You had to start your own business because our world is not set up to deal with people's individual things. And if you're working for a big company, it's very hard to get the things you need to be able to be productive. So you started your own business so that you could schedule things in a way that worked for you. And that this is all very, is that, did I grab enough of it?
You got it. Exactly. Yes. Yes. And it is cool. I am now seeing how it's like we have to kind of take control to design our own lives. And I think it's so hard because we want to be able to just fit in and do what everyone else can do. And I think a lot of times it's like our bodies, like you were saying earlier, it's just hard to human. And sometimes it's like we're just not quite cut out for that like productive, grinding lifestyle. And it's so hard to step back and think of like, how else can I do it? But I think once we really give ourselves permission to ask that question and get serious about it, it really opens up doors and makes life feel a little easier to live.
I mean, I feel like I'm super fortunate in the privilege level I have that when I was working, I was able to do that. But even with that privilege level, I had to start my own businesses because there was no place that could accommodate me. And then there is the sort of judgment that you deal with people where it's like, oh, you're sick. oh, how lucky you get to sit around and eat bonbons, or oh, how nice, I would love a vacation. I'm like, what is my life is? Like it's this idea of like people want to escape productivity when I feel like it's the opposite. Everyone I know who's on disability, we all are incredibly productive from our beds and we want to be a part of things. We don't, I think like that's just one of the big misunderstandings between sick people and healthy people. There needs to be a better ambassador. And I feel like the media is not doing a good enough job. Like we need more of our stories from our mouths on how much we want to do things. And the healthiest gazelle thing in the middle of the lion pack. I'm fine. I'm fine. I can do this. I so hear that. Like coming out of the disability closet was the scariest thing I did when I was a business owner. That was terrifying.
Yeah, absolutely. It is unfortunate how much there's that stigma around it and how it's, people think, oh, it's hard to get a diagnosis. And then it's like you get a diagnosis that no one even understands. And then, there's this, oh, well, you must just not want to work. And it's like, yeah, you'd feel so much better if you could just be productive and just do a job. Like people would choose that every day, all day over living with these chronic conditions, hands down. And yeah, I'm not sure the best way to make people understand that, but I think it's tough where it's this I think the world should be able to make better adjustments and be more understanding and be more accommodating. And I think at the same time, we just have to be so like radically honest with ourselves and say, maybe that just isn't for me and that's okay. How can I do something that will work? And like you said, that usually comes from a place of already having privilege and having resources and all that. So sometimes it's not possible, but I think just staying open and staying creative that a lot of people with chronic conditions have so many like amazing ideas and things they can bring to the world. And I think it is like, how can we get that out there? Like you're just saying, because it's so needed.
I mean, as we saw during the pandemic, it's perfectly possible for people to go to school online and to work from home. This is all distinct possibilities that allow employers to have such a large pool of people who are very good at problem solving. Like if you are trying to figure out how to get from here to the bathroom and your legs are dislocated, which was my morning, you get very good at problem solving on how to think outside the box and you can't just do something as expected.
Exactly. Yep. Yeah, I think it is just like, how can we be creative with what we need and then figuring out for yourself what it is you need to, which partially kind of going back to, talking about before, like, how do I work within my job? And I spent a lot of time wondering, or thinking about, should I be working from home? Should I be doing more online things? Which I think that part is awesome because you can reach people. And what I found personally is that I'm such a people person, like a one-on-one person. Like I just love being in the same room as someone and I love doing hands-on therapy. Like to me, that's so energizing and I feel so good myself when I can be around someone. Like it's hard work. It's hard on my body. I definitely have pain with it, but at the same time, like I get so much out of it selfishly, like so I love that kind of work. Whereas sitting in front of a computer screen to me is more draining and, kind of gives me more long-term symptoms and that kind of thing. So, it's always like weighing the pros and cons of what works for your body, what gives you energy, what makes you feel good, and then how do we balance that?
You talked about, and again, if this is uncomfortable, tell me to move on, but it was something that hit me when I was reading through your questions. And you talked about your fear of running out of time. And that was something that was almost like a punch to the solar plexus, because I feel like that's been such a thing in my whole life of like, I better get this done. I don't have like the same timeline that everyone else has. I think you're quite a bit younger than I am, but I remember being in my 30s being like, I better like hit the wall with this career. I better travel while I can travel. I better do all this stuff. And it sort of shaped my life. I was wondering if it did the same to you.
Yeah, absolutely. Yeah, I think that is one of the biggest things. And I'm in my mid 30s now. And, I spent most of my 20s feeling really not good at all. I was diagnosed with POTS when I was 21 and, had kind of the chronic stuff for a few years before that going undiagnosed. So really it was just getting through college, grad school, working, but not doing anything else. And it does feel like you kind of just lose, part of your life and part of your opportunities. And then I found now that, even as I'm kind of doing things in a way that works better for me, what I have found, which is still quite annoying and frustrating to me, is that I just do things at a slower pace and I just need more time and I need more rest. And I can't do the daily grind and things just don't come in that way for me. And so it's trying to be patient because I know if I have the patience and take my time, like better things come and I can create more things and I can do better work and all of that. But it's so frustrating to me because I'd so much rather just have that like even energy where I can just show up. So I think I've been trying to really tune into my energy and just allowing like, okay, if I don't feel good, can I just do the minimum, right? Knowing that it's going to ebb and flow and you're going to have those days where, the creative energies come to you or like you have more physical energy where you can go do something. And so just kind of thinking about all of that differently too, where it's consistent in a different way. And then, yeah, I don't know, the time, it's tough. I think a lot of people probably feel like, they had some time stolen from them or they're not able to utilize their time as well, which I think partially comes from the whole, issue with productivity where we feel like our whole sense of worth is how much we're doing and we're never doing enough. So just sitting with that.
I'm just very much feeling that. Like I have kids and like the never doing enough, never getting it finished is very, very hard. And when you add on chronic illness, whole different world. We're almost at the end of our time. And I always ask this one question just because it's one of my favorites. Do you have any purchase under $100 that just makes your life happier? And it could be anything. It does not have to be physical therapy. It's just anything that makes your life a little bit more bright and happy.
Well, I'd always say go for chocolate. That'll always do the trick. And that's under 100.
That is a beautiful. I don't know if you guys have Mike's chocolate out there, but my God, that's the best stuff.
No, I don't think so.
Really? Like $5. And Trader Joe's does a very good job with their macadamia chocolate.
Yes. They have fun ones to explore. So that's always fun.
I'm a big fan of that. Thank you so much. We're going to have links to your TikTok and your Instagram. Is there anything else you wanted to plug or make people aware of?
I do virtual consult and coaching calls for really big groups. So that's also an opportunity. So as much as I do love my in-person and hands-on work, I think it's so fun to be able to kind of broaden the scope with virtual practice and get to reach people further. So yeah, just reach out. And yes, you can find me usually on Instagram the most, but yeah, I'd love to connect.
Well, we will have your information on our show notes. So if you are outside of, I'm blanking on which state you're in the United States.
I'm in Minnesota.
Minnesota. So if you're outside of Minnesota and there's, you need some consult, we will have your information right there on our show notes. Thank you so much for joining us. I really appreciate your time.
Thank you so much for having me. This was awesome.
Everyone, be kind, be gentle, be a badass. Keep an eye out. We're going to have hopefully 2 new podcasters joining the network. So keep an eye out for New and Dion.
Thank you for joining us today. To find out more about today's episode, including show notes, transcripts, and more, please visit invisiblenotbroken.com. Please rate and review us on Apple Podcast, Spotify, or wherever you listen to podcasts. You can also support this show by heading over to our Patreon or by sharing these episodes. We are non-advertising, and our growth is thanks to you listeners. Thank you to our hosts Monica and Rita for a wonderful discussion. This episode was edited by me, Luke Spine. Last but not least, be kind, be gentle, and be badass.